With New York's 2025 legislative session beginning soon, advocates say Daniel's law could see a vote.
We want to be able to say, any New Yorker, no matter where you are in this state, if you find yourself in a mental health crisis or someone you love is in a mental health crisis, we have a system in place to answer that crisis.
The bill, named for Daniel Prude, aims to create statewide standards for mental health responses. Prude was restrained by Rochester police officers during a mental health call in March 2020. He died at the hospital a week later.
There was hundreds of people who came and gave their input. The task force met with other programs as far as, Toronto and all over this country.
The Daniels Law Task Force recently released a new report, making several recommendations for implementing Daniels Law. Health-led teams using standardized protocols for behavior health crisis response, a technical assistance center, and area-specific pilot programs.
There has to be also some reform around how we are dispatching, what questions we're asking for those folks who are calling, right?
A key tenet, making sure people in crisis receive public health-led responses without police, unless there's a threat of violence. For members of the law enforcement community, this can be a gray area.
And, we've seen some of the bigger cases where people have died that are in mental health crisis. And not a single police officer wants that ever to be on their shoulders and have that happen.
Police in Monroe County work alongside services like the Forensic Intervention or Person in Crisis teams. Currently, these workers stage themselves at calls until police determine safety. But Chief Long says that decision can't be made over the phone.
It's about the teamwork. They have one set of tools. We have a different set of tools, and we can work together to make sure they're safe, we're safe, and more importantly, the person in crisis is safe.